Sexually transmitted diseases. We'll start with syphilis. Syphilis is caused by a bacteria called Treponema pallidum. It is a spirochete. It has a spiral shape as shown in the image. This is a microscopic image of Treponema pallidum, which causes syphilis. Syphilis is categorized into primary syphilis, secondary syphilis, latent syphilis, and tertiary syphilis. I will start with primary syphilis. The first or primary lesion which occurs in syphilis is called a chancre, and this is how it appears. It is a painless, firm, round lesion. This patient has a lesion in the tongue, most probably because of oral sexual practices. Chancre lasts for 3 to 6 weeks and it heals automatically with or without treatment. But in the absence of treatment, primary syphilis can progress to secondary syphilis. Secondary syphilis is characterized by skin rashes and mucous membrane lesions. These rashes appear either during the healing phase or several weeks after the primary syphilis lesion, the chancre, has healed. Secondary syphilis is characterized by the rash, which is rough red in color or reddish brown spots, as you can see in this image, and it occurs characteristically in the palms and the feet, where normally you don't get the lesions from most of the diseases. So this is used for diagnostic purposes. The appearance of these rashes in the palms and in the feet. The next lesion associated with secondary syphilis is condyloma lata. You can see the bottom image here, the anal region, and here we have the condyloma lata lesion, which is nothing but raised gray or white skin lesions. These are characteristic and diagnostic of secondary syphilis. Of course, you have to correlate with other symptoms. It is during this stage that, being a bacterial infection, syphilis produces fever, headache, lymphadenopathy, sore throat, weight loss, etc. All those general flu symptoms appear during the secondary phase of syphilis. These also will resolve with or without treatment, but without treatment, syphilis will progress to the latent stage and possibly the tertiary stage of the disease. Next, we move on to the latent stage of syphilis. As the name suggests, there are no symptoms or signs, and this phase can last for years, even when the disease is present or the organism is present in the body. This is divided into early latent syphilis and late latent syphilis. Early latent syphilis is if the latent phase occurs within 12 months of the occurrence of chancre, and late latent syphilis if the infection had occurred more than 12 months ago. Tertiary syphilis. This is a rare condition and is mostly seen in untreated cases. can affect multiple organ systems including the brain, eyes, heart, blood vessels, liver, bones, and joints. When it affects the brain, it causes neurosyphilis, which results in altered behavior. It can affect the eye and even cause permanent blindness in some cases.